U.S. House and Senate negotiators are still trying to pass a new farm bill ahead of the Thanksgiving recess, with several issues unresolved. One involves nearly $40 billion in proposed cuts in the SNAP program. House Agriculture Committee Chair, Oklahoma U.S. Representative Frank Lucas, believes a final version of the farm bill could go to President Obama by the end of the year. During a recent town hall meeting in Weatherford, Lucas updated constituents about progress on the farm bill and concerns about implementation of the federal health care law. Here's more in this ONR Extra.
Agriculture is the driving economic industry across this whole congressional district. So what kind of a farm bill we have, what kind of a safety net to make sure that we have the ability to raise the food and fiber we need, as well as what kind of safety net we have for consumers who faces challenges on the other end of the perspective is a very important thing. And we're in the process of trying to sort out the differences. And you would say, well, what are the differences? Well, the three big areas of discussion: dairy, commodity title, food stamps, SNAP. The national media is focusing more on the third element of this sorting out the farm bill, and that's SNAP, the food stamp program. Senate proposes to save about $4 billion. House is on record wanting to save $40 billion. Under another twist in the 1996 Welfare Reform Act, a number of states say that if you qualify for a federal welfare benefit, say TANF, then you automatically get food stamps without applying. The House perspective is we want to help everyone who qualifies. We want to make sure everyone who needs help gets the calories they need. But the House perspective is everybody needs to show you qualify. Show your income records, show your assets records, and we'll help you. But everybody needs to show they qualify. Obamacare, how could I almost forget? This is the topic that lights up my emails, lights up the phone lines. You know, I didn't vote for it.
I just want you to know that it's not working out here. I can say that there are certainly people that benefit from that. I can certainly sympathize with those that have health issues that haven't been able to get coverage. That's a good thing. But for your younger people that are seeing a huge increase in their premiums, even though there are some subsidies available, it doesn't match up. So we're waiting for it.
Absolutely, Mike. And there's some provisions in this bill that really come back to bite people. The Cadillac tax, whatever they call it, on the higher end coverage. Your bigger national labor unions have spent, in some cases, a half a century trying to perfect their health insurance as a part of their negotiated agreements. And the way Obamacare works, if your benefit package is above a certain level of standard, if it provides more things, it's better than is defined, then you get taxed for that. They call it Cadillac coverage because they want to pull the top down just as they pull the bottom up. Just things like that have taken a lot of people by surprise. And as Mike alluded to, when we all at least believed what we were told, that if you liked what you had, you get to keep it, that little nuance at the bottom is only if it meets the standards of the new program. And there are very few things that meet the new standards in the way it's put together. This is just the most amazing thing. And the frustration of the cutoff notices for people, the frustration of trying to use the online site, the frustration of the administration dancing around on it. It's just maddening. But that's why a number of us said some time ago, back this up. Get your software to work. Make your policies and your plans work. Don't just herd us down the trail